how we doing? My name is Coach Sean Cook, owner of Crucible Strength and proud collaborator and trainer here at the Lion's Den. And we're coming to you today to discuss the deadlift. The deadlift is a wonderful exercise, and we're going to break it down today from the top position and the bottom position. So today we're just really talking about what does the posture look like, what does the position look like in the deadlift. So starting out, when we approach the deadlift, so I'm going to get it up to the top for a moment and we're going to start discussing pieces. So I like addressing the top first just because there's so many things that can go wrong from this position. So let's talk about the neck. From the top position, neck is neutral, chin can be slightly tucked. What we don't want is to have this over tucked position, so slightly tucked. From the shoulder position, we want the shoulders locked down and back into their socket, and kind of externally rotated, and the bar is as tight to the body as possible, and that's done by the shoulder. So you're not in excessive flexion, it's quite the opposite. You're in extension right here. From the elbows are straight, not bent, wrists are straight, and you're in this double overhand position unless you're at a heavy weight, you've chosen to use a mixed grip. Okay, now moving down the body, the scapula. The shoulder blades in this position should be, in the top position anyway, should be retracted back, not protracted and rolling forward. Downstream, the thoracic spine and rib cage are in an extended but neutral position, so not overly flexed. You're in this braced neutral compared to the rest of the spine. Rib cage is stacked nicely over the hips. Continuing to move downstream now to the lower back and pelvis. So same thing, we want this low back in a braced neutral position compared to the rest of the spine. The pelvis is in also this neutral position, stacked nicely over the knees and ankles. So what we're looking for, just to recap, is the spine, especially the cervical, thoracic, and lumbar, all in this nice braced neutral position. Okay, and finally, let's discuss the knees, ankles, and feet. Knees in the top position of a deadlift are locked out, not hyperextended, but locked out under the hips, over the middle of the foot. And the ankles are stable, not collapsing in, and the feet are pointed forward. Relatively, you can maybe be slightly turned out, and you're in this tripod position where the toe, big toe, pinky toe, heels are firmly on the ground. You have a nice controlled arch in the foot. Okay, so now let's address the bottom position. Went over the top, now the bottom position. Now this is where the deadlift will start out, and we're going to make sure and do the same thing and come from the head and neck first. So let's address that position. In the bottom position of the deadlift, head and neck, again, in this braced neutral position relative to the rest of the spine. So we're moving down, shoulders. In this position, from the bottom position, the shoulders are slightly protracted, slightly forward. Contrary to popular belief, it's not great to have them excessively pulled back. They won't be hunched, but they will be forward a bit. Moving downstream into the shoulder blade itself, this one's an important part because if you look from the side, the shoulder blade should be over the bar, not the shoulders. The shoulders actually should be slightly in front of the bar. It's the blade itself, the scapula, that should be directly over that bar. And those shoulder blades, again, are kind of slightly protracted forward, okay? From there, mid-back thoracic spine, we want that mid-back thoracic spine in a braced neutral, so not slouched or hunched. Let's go back to the arms. Elbows straight, wrists straight, and again, we have that overhand position at the hand position. So when we get to the lower back and the pelvis, this one too, just like with the rest of the spine, we want lower back, pelvis in this braced neutral position, normal lumbar curve, and then butt is pushing back. The pelvis is actually an anterior tilt at the bottom position of a deadlift. Okay, so from the hip level, see the hip is in flexion, knees are in flexion, but the knees are only in flexion to a point to where you can keep the shins vertical. So we don't want the knees to flex so far forward to where we're losing this vertical straight up and down shin angle. The ankles, just like the top position, ankles are in this nice tripod position, not caving in, toes especially the big toe, pinky toe, and that rear foot is firmly on the ground and not letting those ankles cave in. When doing the deadlift, as all exercises, breathing is a huge component, especially on any of these compound barbell movements. So let's talk about two options we have for breathing in the deadlift. I'm gonna go over option one first. This is one I favor, but it does come at a little bit more of, I don't want to say risk, but if people who are prone to potentially passing out, you have to build yourself. It's not unsafe, but you have to build yourself into this first method I'm going to show you. And it is taking the breath from the top. So the reason, first off, I love to do this is because at a top position, you're gonna have more room to take in the big breath, and you need a big breath. So what we do is we approach, say we've done our whole setup, and I'm gonna do a rep or two, but from here, we want to take in and inhale through the nose the biggest breath you can, but we want to fill this cylinder. We want to fill with the big breath, not shallow breathing through the chest, but filling the cylinder almost like you have this tight cylinder, you're compressing as much air into this as you can. If you were to put your hands around here and take in a big breath, you should feel it expand the hands and not just chest breath. So I'm going to show you what that looks like, but take note too, I'm taking that breath in and I'm going to then hold that breath in, and this is how it gets a little problematic for a beginner. You want to hold that breath in as I go down, grab the bar, breath is still in, and then I'm coming up and only exhaling as I finish the very last extension portion of the deadlift. Here's what that would look like. I approach the bar, I get set up, and then at the top, you heard that breath. I'm taking that breath right before I go back down. Okay? So that would be breathing from the top. And so that brings us to option number two. Chances are, especially someone new to the deadlift, method one may not be there yet, but that does get better the more you practice it. But let's say you know and you feel, hey, I'm taking that breath, but holding it in that long, get a little lightheaded. We obviously don't want you to get lightheaded with that bar in your hand. So the option two is to breathe at the bottom of the deadlift. The only problem with this is just know you're still taking in as big a breath as you can through the nose and then exhaling it through the mouth. But when you're already in the bottom position, compressed, it is harder to take in as much air as you can from the top. But it still is an option. Just keep in mind you want to get as full with air as you can. So that one would look like this. This one you can take your time. You can come get set up, get tight, right? And then from here, the best you can in this compressed position, but the breath still comes out at the top. I get back down. Okay, but the concepts are still the same, still trying to fill the cylinder with air. So that's breathing for the deadlift. So common faults of the deadlift. We'll go from the top and bottom again, just to show you the common things that could go wrong. There are some other ones, but these are the ones we as trainers see most often. So let me get this back in the top position. Okay, so a person finishes their deadlift and they get up here to the top. A couple things, let's go neck and head first. Two obvious ones. This is less likely to happen where the person's looking up. That tends to happen on the squat a little bit more. The one you'll see here is the excessive tucking of the chin buried in the sternum. The other one that you absolutely don't want to do under heavy load or any load, especially for beginners, is turning the neck to the right, to the left, craning your neck to look when you are under load. So that would be common faults at the head and neck level. Common faults of the shoulder. At the shoulder level in the locked out top position would be this excessive kind of shrugging of the shoulder or too much internal rotation of the shoulder at the top. That brings us to the shoulder blades because it kind of goes along with the shoulder. The scapula protracting forward. If you can see, I'll move. This position right here would be kind of nasty for the body. Moving into the mid-back thoracic spine, common thing that's going to be here would be the thoracic spine losing position. So at the top, having that hunched kind of lazy position with that mid-back, horrible for the back in the deadlift. So at the pelvis lower back position, the common fault that can happen here is, very much like the mid back, is just losing position and being at the top of the movement in this anterior tilt. So you have this sway back. Instead of extending from the hip like this, people do not extend from the hip and they instead lift that rib cage and go a little bit too much into that lower back. So at the hip, the common fault here goes along with that low back, is not hitting extension. So you get to the top and the hips do not fully extend, squeezing the glute. They're still kind of in this flexed, bent position, which brings us to the knees, same thing. The other thing that can happen common fault-wise is getting to the top lockout and you have this little bent knee position. They're trying to straighten out, but they still got bent knees. We want the knees, we want the hips stacked over each other. As a matter of fact, as you come up, the knees and hips should simultaneously lock out at the top. You see this nice stacked position. And then that brings us to the ankles. So at the top of that deadlift, when you get here, common fault at the ankle position is going to be the caving in of those ankles. One other little thing to mention at the hips as well, not as much as the squat, but we still want to see at the top that you are not allowing just like knees caving in, being sloppy. And that'll be on the down as well. Okay, so at the bottom of the deadlift, common faults here, start again at the top with the head and neck, similar as with the top, except a little backwards, the most common one. So whereas at the top, the common one is to over tuck the chin, at the bottom, the common fault is to be looking up. So you get to the bottom, this chin's up, the neck is offline with the rest of the spine. Shoulders at the bottom, a common fault will be either too much. Now we want a little bit of this protraction because the bar's hanging down, that's natural, a little bit. But sometimes someone goes a little too far at the bottom, shoulders are pulled forward and kind of shrugging. Or the other major fault that can happen is person's been cued to over retract the shoulder blades. So you can get to the bottom and be almost like too retracted with the blades. Your lats should be dialed in, but when you're trying to overcorrect, it can pull you up and lift your rib cage actually up a little too much and you start losing core stability. So shoulder blades, the same thing, goes along with the shoulders. We want the shoulder blade being nice and stable here, slightly protracted. Common fault will be those blades just getting really sloppy or being way too pulled back. So elbows, common fault at the bottom is the same as with the top. Bent elbows, getting down here and just losing tension. So moving downstream to the mid-back at the bottom, flexion of that mid-back, kind of rounding of that mid-back at the thoracic spine, rib cage goes down and gets sloppy. Same thing here. We have a couple things that can happen with the low back. The typical one is going to be person's trying to stay straight. So I'm going to go straight and rigid real quick so you can see. The other one that you'll see is, you see the lumbar spine begin to round just a little bit before takeoff, and then they come up in this really horrible punched position. Hips. Getting here, what we typically see at the hip and knee level, common fault with the deadlift, is people squatting their deadlift. So you'll start seeing people adopt, as they go down, this squat mechanic, and you see how that pushed the bar forward. So they start at the hips and knees adopting the squat, and the knees flex forward a little bit too far, brings you onto your toes, and the ankles tend to cave in and get sloppy. So all those pieces are connected. So the common fault there is just adopting and not learning the difference between the deadlift and squat mechanic. So those are the common faults at the top and bottom position of the deadlift.